Evidence has proven that nurse midwives as providers, you're going to have more successful labor progress in general.
Some people think of a midwife as just like Little House on the Prairie, where Caroline would go sit with them.
A midwife can be a little bit more hands-on throughout the labor process and be able to give a little bit more support.
Julie, you are a certified nurse midwife, and it is so confusing for people because some people think of a midwife as just like Joan down the street who delivers babies, like on Little House on the Prairie, where Caroline would go sit with them, right? Versus somebody where you've had like a residency, plus you were a labor and delivery nurse before you were a midwife. Like it's an extensive training. And the beauty about a midwife that I think a lot of people don't understand is you always have an OB where you're kind of like, we're starting to get in the weeds here a little bit. I'd like a consult with a little higher up, right? I'd like to move this up. So what's the best part of having a midwife deliver your baby, Julie?
Yeah, the first part of that, I think, is that the understanding that, yeah, we're not obstetricians. We don't have a physician training. We can't do surgeries, right?
Yeah.
But we actually manage, not all of us, it depends on our training and our experience, but most of us manage high risk conditions throughout as well. It's not just like the most low risk person is the only one that can have a midwife as a provider. So I will manage people with hypertension, people with regular diabetes or gestational diabetes. Like those are things that I can help manage. So we're not just like the lowest risk people and that's all. So we're not exclusively keeping people that have high risk conditions out of our care. We can do that. Again, there's much more of a holistic approach. So we're looking at the whole person and like you have 5 other children. How are we going to get you to twice a week fetal testing appointments, right? How is this going to work for you instead of just saying you need twice a week visits, figure it out. Like we're going to try and work through, the whole scenario as well as looking past those points, like maybe a C-section is recommended. Again, you have 5 other children. How's your recovery going to be? What are you going to have in place for that? I just think we do a better job of being able to see, especially because we've been a nurse before, so our perspective is not as medical. It's nurse and holistic person perspective. So I think that's really valuable. And then depending on where you're practicing, it's not always this way, but hopefully a midwife can be a little bit more hands-on throughout the labor process and be able to give a little bit more support than the OBs who are busy with surgeries, busy with a million other things that we don't have to do.
Yeah. Now, of course, I want to caveat this that there are OBs who practice very similarly to midwives, I find, and there are midwives who practice very similarly to OBs. So
Yeah.
I'm not saying that you just be like, oh, she's an OB or she's a midwife, she's going to be amazing. Because some midwives I've worked with and I'm like, oh my gosh, we're all going to die today. Or I've worked with OBs and I'm like, oh my gosh, like they want to be here from 6 centimeters on. Like they clear their schedule and they just make it and they really want to be there for the patient. They love that part of it. So obviously you want to find the provider that's right for you. But I get so many people in my groups that are like, well, I didn't want to have a midwife because she, what if something went wrong? I got diabetes or preeclampsia or something. And I'm like, no, like that's not going to preclude you from using them. Maybe you go see an OB for one appointment and then you go back to your midwives, right? I think
Yep,
a lot of
that's
people don't
absolutely right.
understand that there's like midwives, there's OBs, and then there's perinatologists or maternal-fetal medicine, right? Like there are always these different levels of care that we're kind of like, we're kind of in the weeds here. Let's get somebody higher.
Yeah, and that's the thing is like a lot of these things, I can just make a phone call and be like, hey, maternal fetal medicine, what's our plan? But I can still implement that plan and be the primary person throughout the pregnancy journey. And that's really, really helpful, I think. And that's what it should be. We should try and keep ourselves connected with the people that we know and have a relationship with if we can.
Yeah. And I see midwives doing informed consent. It tend to be overgeneralizing all along the way, right? Like they'll at 36 weeks, they'll be like, hey, I am seeing that you might, your blood pressure is trending up a little bit. There is going to maybe be a possibility of an induction. I just want to put a little seed in your head so you can start to think about what's important to you and how we're going to balance that with an induction. We're going to see you next week, right?
Absolutely. That's exactly what I do. Evidence has proven that nurse midwives as providers, you're going to have more successful labor progress in general, and that includes induction. Part of that is because we're not, and this is a very general statement, but generally speaking, we're not as tied to really specific timeframes and milestones throughout. We're going to individualize that to exactly what your body's doing,
Shout out for midwives because they're there. So that's how they can tailor it, right? Whereas an
Yes.
OB calls in maybe every 4 to 6 hours. They're not there. They aren't kind of watching everything every step of the way. Shout out for
Yeah.
midwives, guys.
Yeah, historically and generally speaking, we're going to be a little bit more present in the care and be able to kind of doing informed consent all along the way instead of like just this one discussion, at 39 weeks right before your induction.